Hello guys, welcome to my second video of the Host of Pharmacology series. This is the second section and it is on anti-tubercular drugs. Okay, well let's see what's it about. What is tuberculosis, you may be asking? Well, it's a contagious bacterial infection. By this bacteria, you don't only have to know what this bacteria is, but you have to know that it is contagious through the air and that a lot of people are infected annually. Right here, it affects the lungs, but it can spread to other organs. Remember this for later. We'll be going over this section a little bit later. So basically, it's in the lungs. It's a bacterial infection. It's in the lungs, and it can spread to other organs. Plus, it is highly contagious. These are all 4 drugs. I would suggest memorizing each of these drugs and what exactly they do, considering that there's only 4 drugs and it's a sort of a big section. First drug, isoniazid. As you can tell, this is the most popular anti-TB drug. Um, I don't think you really have to know the mechanism of action for this, but you should know that it can cause peripheral neuropathy, which, if you don't know what peripheral neuropathy is, it's basically damage to the nerves, like your exterior nerves, which means like you may feel tingling or numbness in your hands or feet. That's what peripheral neuropathy is. Uh, Contraindications are liver disease and hepatic impairment, which is like kidneys. Wait, scratch that. Liver. Hepatic is liver. Do you guys know what the root word for kidneys are? It's nephra, if you guys wanted to know. Okay, yeah, but that's really all you have to know for now. Rifampin. This is also the second biggest drug, and yeah, it's very similar to uh, rifampin. Is very similar to isoniazid. And a common side effect is hepatotoxicity, or yeah, kidney toxicity. And here's the main part you have to know about this. It's the fact that your body fluids can turn orange. So that means, yeah, like urine, tears, sweat. This can all turn orange. This is normal. So if this happens, if a patient has this during treatment, it's perfectly normal. This one just means low white blood cell count. And yes, that's really it for now. Ethambutol is basically like this. Side effects are eye problems and mainly just eye problems, really. Optic nerve disease. So yeah, just remember, this is eye problems. Pyrazinamide. This is, I would say, like the least used drug, but still one of the big 4. So basically, this is how it works. Common side effects. Gout is a disease we'll learn about later, way later in the series. But yeah, so I would say joints is what this thing hurts. Serum uric acid and gout go hand in hand, but you'll learn about that later. But basically, this one basically affects the joints, and yeah. Okay, it's basically in order to treat TB, you have to use DOTS, which is directly observed therapy, short course therapy, and it's used for TB. And basically, in this DOTS treatment, there are 2 phases: phase 1 and phase 2. Phase 1 is the shorter one, which is still relatively long, and it is contains all 4 of these drugs. Usually, well, sorry about that. Usually, phase 1 is much safer and less risky than stage 2, which has higher risk for toxicity and is usually less effective. Yeah, as you can tell, the total duration is really long. Okay, these are the big ones. I would suggest taking a screenshot or a picture of this screen because it can be very helpful for later. Basically, rifampin. We'll go over all these later, but sorry about that. Okay, these are some you want to know for the test. Rifampin is orange body fluids, normal. Visual changes are for, what are they for? Yeah, you got it right. It is for pyrazinamide. Wait, no, it's for ethambutol, right? Yeah, color. And I wrong. Ethambutol. I guess for any drug, you should really avoid alcohol. And yeah, this is it. What you should be doing. That's why you need routine monitoring and dots, also known as directly observed, because they need to be directly observed because of these problems. And so, yeah, I usually don't suggest memorizing drugs, but again, these are just only for drugs and they will be helpful to memorize. Thank you for watching.